This video will explain how to replace the feeding connector on a Freka PEG tube and also how to advance and rotate this type of PEG tube. You will need a replacement Freka PEG adapter of the appropriate size. The sizes are 9 French or 15 French. Yellow indicates a 9 French tube and blue indicates a 15 French tube. Before replacing the Freka PEG adapter, wash your hands for 20 seconds. You should also wear gloves and an apron if you're in a clinical setting. If you are changing the Freka PEG adapter for someone else, you will need to explain the procedure and gain consent from the patient or perform the procedure in the patient's best interests. Close the clamp on the Freka PEG tube. Unscrew the previous hexagonal fixing screw from the adapter. Gently pull out the previous adapter from the PEG tube. If the connection at the end of the PEG tube is loose or the tube is stretched, trim approximately 0.5 centimetre off the tube length using clean scissors. Slide the new hexagonal fixing screw onto the tube. Insert the new adapter, then slide the fixing screw towards the adapter and screw together using the outer white ring. Remove the outer white ring to prevent accidental removal of the adapter end. This video will also explain how to advance and rotate a Freka PEG feeding tube. Once a PEG tube has been in for 2 weeks, it must be advanced and rotated at least weekly and no more than daily. This is to prevent the bumper inside the stomach from becoming stuck and buried in the stomach lining. To advance a Freka PEG, open the yellow or blue fixation clip and remove the tube from the groove in the fixation plate. Move the fixation plate away from the skin and follow the advance and rotate instructions. Push it in by 2 inches to 4 centimetres and rotate 360 degrees. Once done, pull back on the tube to feel resistance of the internal fixator. Return the triangular fixation plate approximately 2 millimetres from the skin. Place the tube back in the groove and secure with the yellow or blue clip. Ensure that the external fixator is not too loose or too tight. If you need to replace a PEG clamp, you will also need to follow the instructions as given previously regarding how to change a Freka adapter. Please note that you will need to pinch the tube when replacing the clamp to avoid leakage of gastric liquid. Call the Gloucestershire Home Enteral Feeding Team, GP surgery or community children's nursing team if you need an additional spare Freka PEG adapter or Freka PEG clamp, or if you have any difficulties during this procedure. Thank you.